We've already discussed the sense of pain, touch, pressure, temperature, and position, so I won't go through them again, but I'll show this image here from the textbook and tell you that on pages 233 to 236, you can find more information about these general senses. I recommend that you go there and read about this content because there's more information within the textbook than I got into earlier in the videos. One of the general senses that we want to look at here a little bit is pain. Recall from earlier in this unit, the receptors for pain are called nociceptors. These respond to things like putting your finger on a pin, as shown in the image here. As those nociceptors are damaged, they trigger the action potential on the sensory neurons. But we'd like to look at a couple of concepts that are related to pain. Let's start by looking at referred pain and explain that concept. The concept of referred pain is when we have pain receptors being triggered in one part of the body, triggering an action potential along sensory neurons that then go to our central nervous system. But when our central nervous system processes that pain information, it can't differentiate between information coming from that area of the body and various other areas. So for example, here's a person with areas marked for referred pain. As you can see, the heart area is marked over the chest, but also down the left arm. What's going on here is if this person were to be having, let's say, a heart attack, where their nociceptors in the heart would trigger an action potential along sensory neurons into the central nervous system to tell the brain that the heart is being damaged due to this heart attack. As that information runs along those neurons, you'll recall that earlier in the course when we talked about nerves, a nerve was many neurons bundled together. Those neurons coming from the heart are bundled together in nerves that also have neurons coming from the left arm. Once that information about the heart attack, the pain, gets to the brain cannot differentiate very well between the chest and the arm because it's receiving information along the same nerve from both areas. And so a patient having a heart attack would also maybe be experiencing pain along their left arm. There are some other regions shown here based on the concept of referred pain, appendicitis and where you might experience pain, renal colic. But then the liver and gallbladder is another extreme example, where somebody who might be having damage done to their liver and gallbladder and therefore experiencing pain, or maybe they have gallstones, would be experiencing pain maybe in their abdomen where those organs are located, but would also be experiencing pain in their shoulder. This is a concept that is important to note because as you work with patients, somebody might be complaining of pain in a region that is seemingly unrelated to the actual issue going on in the body. For example, the liver and gallbladder, there might be damage going on, but the patient is also complaining of shoulder pain. This is a good concept to understand when we're dealing with patients because a patient might be complaining about shoulder pain even though it's their liver and gallbladder found within their abdominal pelvic cavity that is the issue. A few other concepts we want to explain here are sensory projection and adaptation. Sensory projection is the concept that we get sensory information about pain sent to our brain and our brain processes that information, but then it tells our bodies where the pain is actually occurring. Even though we're processing that information in the brain, our brain can project that information back out to our body, and we know that it's actually, in this case, our thumb that was hit, even though we're not processing that information in our thumb itself, but within our central nervous system. So projection answers the question, if pain is experienced by the brain and processed by the brain, why does my injured finger hurt? And it's because our brain projects that information back to our thumb and tells us that that's the region that's hurt. Another example of projection is the experience of phantom limb pain. So if a leg is ever amputated, as is kind of indicated in the image here, we might have the person still feel pain from that amputated leg. The missing leg often throbs with pain. And why does that happen? It's because the severed nerve endings in the amputated leg continue to send sensory information to the parietal lobe of the brain. And the brain interprets this information as pain and projects the feeling back down to that leg area, even though that area is now missing due to the amputation. One bit of good news that you'll note is that the sensation often locates the amputated limb and helps a patient learn how to use an artificial limb. So in this example here in the image, if this person was given an artificial leg, then eventually they would learn how to use that leg more efficiently because of sensory projection and the processing of information as if it's coming from that area. Sensory adaptation is something you've potentially experienced before. I'm showing this silly image here just to indicate you've probably walked into a room before where there was a fairly disgusting smell. At first you walk into the room and the smell is almost unbearable. But over time you begin not to notice the smell as much anymore. Maybe other people come into the room and they ask you about this smell and how strong it is, and you realize that, oh, I kind of stopped smelling it as bad, or I'm not noticing it as much anymore. Sensory adaptation is the concept of sensory receptors adapting. Because the sensory receptors in the nose are constantly being stimulated, in this case by the smell, eventually those receptors send fewer and fewer signals to the brain. Therefore, there's not as great a sensation of smell in this case.